evening, everyone. Welcome to the Healthy Living series. We're just going to wait a couple, just a moment to allow for everybody to get into the webinar, and then we'll get started. Hi, everyone, and welcome to the Healthy Living series. I'm Angelica Ladd, Community Relations Specialist here at Dartmouth-Hitchcock Health. This evening, we are joined by John Broderick, our former Chief Justice of the New Hampshire Supreme Court and Senior Director of External Affairs at Dartmouth-Hitchcock Health, and Bernie Seifert, Director of Adult Programs at Nami, New Hampshire. And tonight, they're going to talk about the best ways to support a loved one during a mental health crisis. But first, we do have to clean up some housekeeping items. Tonight's event is being recorded and will be posted on our Healthy Living series webpage at go.d-h.org/HLS. And it will also be posted on YouTube, so you can view it there as well and share it. We have closed captioning available this evening. If you click on your closed caption icon, you should be able to click on something that says show subtitles, and you'll be able to follow along that way if you need to. If you would like to ask a question this evening, please use the question and answer function, the Q&A function. And we should have plenty of time at the end of tonight's event to answer your questions. At the end of the event, you will receive a quick 3-minute survey just to let us know how we were doing tonight, and to also help us with future programming, to let us know what you're interested in for future Healthy Living series events. Again, thank you so much for being here. We're going to kick things off now. I'm just going to give short bios of our great guests. Thank you so much for being here. First, I'm going to start with Bernie Seifert. Thank you so much for being here. MSW LICSW is the Director of Adult Programs at Nami, New Hampshire, which is the National Alliance on Mental Illness. She is also the social worker for the Northern New England Geriatric Workforce Enhancement Program, which is part of the Dartmouth Centers on Health and Aging in Lebanon, New Hampshire. She earned her MSW degree with a sub-concentration in aging from Boston University and has been a licensed clinical social worker serving adults and their families in New Hampshire since 1988. Her current affiliations include the Board of Directors for the National Association of Social Workers and past president of the Board of Directors of the New Hampshire chapter of the National Association of Social Workers. Thanks so much for being here, Bernie.
Thank you.
And we also have tonight John Broderick. John T. Broderick Jr. is the Senior Director of External Affairs at Dartmouth-Hitchcock Health. Prior to joining DHH, he was a member of the New Hampshire Supreme Court from 1995 to 2010, serving as Chief Justice from 2003 to 2010. During his time on the court, the Broderick family experienced the devastating impacts of mental illness in a very public way. For years, Broderick's eldest son struggled with addiction, which had masked a severe underlying mental health issue, which he'll talk more about in a moment. As a family, they survived and healed, and now he uses his experience to help educate others that mental illness is not something to be ashamed of. Rather, it is something to be recognized and to be addressed just as any other physical illness. So thank you so much for being here. We're going to show a quick video to give a little bit more of a background on your story, John. And then, John, you're going to talk a little bit more about your experience as well. So let me get that queued up for us. Ladies and gentlemen, John Broderick.
In any event, I want to thank everyone tonight for tuning in. I came to learn what Bernie Seifert is going to say. She's terrific, by the way. But I really appreciate the opportunity. And I assume that many of you listening tonight are either dealing with a mental health problem or someone you love is a mental health problem. And the first thing I want to say to all of you in that context is that you're not alone. You are not alone. And I thought when we finally realized what was going on that we had been alone, and that was not true. And in the 5 years or so now, more than 5 years, I've been traveling around New England because of the sport of Dartmouth-Hitchcock. I'm proud to be part of that group. I've been speaking mostly to young people, the age my son was when this began, ages 13 to 18, grades 6 through 12. I've been to 300 middle schools and high schools. I've spoken to 90,000 young people. And I wasn't sure when I started that they'd be that interested in what I was saying or that I could keep their attention. I'm not exactly their age. But what has been striking every time I go out, it doesn't matter what the room is. I've spoken to 40,000 adults too. It's a topic that resonates. And during the last 5 years, especially in gyms and auditoriums, this grandfather who these kids have never met, namely me, when I finish speaking, and they will come up to me, I've hugged thousands of those kids. I mean, literally thousands. And sometimes they hug me first. But all of those kids that come up are either thanking me for talking about it or sharing their own mental health journey with me, or the fact that their parents don't believe in mental illness, or that they're ashamed of their mental illness. And my mission has been to let people know there's nothing to be ashamed of. It's nothing anyone chooses, and it's something anyone deserves. But over time, over generations, we've always stigmatized it. We've made people feel badly about it and about themselves. And it is so unkind. And so that I don't sound too righteous here, I was part of the problem for much of my life because I didn't understand mental health. I thought it only affected other people and that if you were really seriously mentally ill, I'd never meet you. And I was wrong about both of those things. I never realized that they were people who were working with me or in my neighborhood or in my circle or someone they loved was in that circle. And so my message has been, we need to stop judging people because they have a mental health problem. Any one of us, myself included, could have a mental health issue. My son, who's doing so much better now, he didn't choose that problem. He was pretty courageous, by the way he fought back and came back. And because of our ignorance, we really harmed him, not intentionally, but in fact, that was true. And so what I'm trying to say to people is, could we finally, after generations, stop feeling about mental illness like it's a failing, a weakness, an imperfection? It's a health challenge, is what it is. And we need to deal with it that way. And I think one of the obstacles people have in dealing with mental health in their own family, especially, is their unwillingness to let others know, for fear that they'll be found out or that they won't think the same of their loved one if they know. I get that all the time, by the way. Kids tell me that. And that's the way it's been. And it won't change just because time passes. It will change because we decide it needs to change. And so the discussion tonight, which I think Bernie will lead in a very informed way, is how do you deal with the mental health crisis or mental health problem in your family or in your close circle? And what I want you to know is that you won't be able to do that effectively, whatever your age or the age of the person you're trying to help, if you are ashamed of it or afraid that somebody will find out. In fact, helping somebody with a mental health problem is a very noble thing, an extraordinarily noble thing to do. And if I had a mental health problem, especially if I had a serious mental health problem, I would hope that people would help me and not be ashamed of that, not be afraid to reach out and talk to others in your family or extended family, your friends in the neighborhood, because anybody who's providing those kind of care services can get pretty exhausted depending on the circumstances. And if you're trying to hide it at the same time you're trying to deal with it, it's going to take a lot out of you. And your loved one will feel that there is something that should be hidden or concealed. We'll just say when I was younger, years ago, my mother used to whisper the word cancer. She used to whisper the word cancer. And some people weren't as brave as my mother. They would say, he or she has a C word. Seems silly now, doesn't it? It wasn't. It wasn't for generations. And nobody said the word breast. No adult said the word breast when I was a child. No one said that in the public square. And no one said cancer. And now we say breast cancer. Makes sense, doesn't it? But it didn't make sense for generations of Americans. And so a lot of women, it's not only women with breast cancer, but mostly women, a lot of women probably died in their 40s. Nobody knew why, because nobody would talk about it. Last year, there were over 300,000 women diagnosed with breast cancer. And we have great protocols, great care. And most of those women will lead a full life, in part because everyone finally grew up and found treatment and cure. It was true for HIV/AIDS. We all know that. In the 80s, those people, we didn't know who they were. And they were ostracized and stigmatized. And then finally, Magic Johnson of the Lakers had to leave the NBA because he had HIV. And we didn't want to lose Magic, and we didn't. And suddenly it was okay to have HIV. Not that it's okay, but it was okay to talk about it. And we found very effective treatment now. And that's all good. It's true for heart disease and dementia, so many things that affect so many people, but not with mental illness, not with mental illness. So my advice, the best advice I can give you, is to know what you're looking at. Maybe we'll talk a little about that tonight, but don't be afraid to seek help. It doesn't have to be in the town square every time, but you're going to need people to give you some relief. The caregiver needs to take care of the caregiver too. And if you're trying to hide it or conceal it or you're ashamed of it, that's not going to help you, and certainly not going to help your loved one. That much I've learned in the last 5.5 years. I've also learned that you are not alone. Trust me when I tell you that. 1 in 5 adolescents will have a mental health issue. 1 in 5 adults too. Almost 1 in 5 of every person you pass on the street either has a mental health problem or someone they know or love does. That's pretty extraordinary. That's tens of millions of our fellow citizens. So whoever in your orbit is suffering, if it's you or someone you love, there are so many people and families dealing or trying to deal with what you're dealing with. So my message is reach out, get help, talk about it. It's probably the most important thing you can do. Don't try to hide it, conceal it, talk it away. That won't help anybody. In any event, thanks for listening. And I know Bernie is going to follow, and I'm really looking forward to her talk.
Okay. Well, thank you. Thank you, John. And that is very difficult to follow, because I think that the main message for tonight is exactly what you just gave, and that is, please talk about it. Don't be afraid to be open about it, and trying to bust that stigma and that discrimination. There's so many different forms of discrimination, and one of it is our own self, and how if we ourselves are dealing with a mental health issue, we need to address that and not self-stigmatize or what's going on. But there's also stigma within a family, and there's stigma within our culture, and even the way mental health is often talked about in the press, in the media. You don't listen to that, and we need to fight that. So we need to advocate to change the way mental health is talked about. And one example is language, and we I heard you, John, on a program just, I think it was yesterday or the day before, in a conference for the New Hampshire Behavioral Health. And so many times through the 2 days of the conference, there was a talk about how we need to change the language and how we talk about mental health. And, instead of saying the mentally ill, it's people who have mental health conditions. So put the person first. And, even, and so if you have a family member, you yourself, or if you have a family member that you're having difficulty talking to about mental health, maybe like taking a look at the language that is used. And I'm saying this, I am continuing to change the way I talk about mental illness. I think back of some of the things I used to say years ago, and I'm embarrassed. Knowing what I know now and knowing how hurtful that language was. So all of us can have room to change and to grow and to be a part of changing the culture and how we look at mental health. And definitely, if you have a family member who is experiencing mental health issues, who's reluctant to accept help, maybe looking at how we talk to them about it. You talk to them about it as if it's a mental health, it's a medical condition, because you know what? It is a medical condition. So we need to think about that. So if you do have someone in your family who is experiencing a mental health crisis or is approaching a crisis, that can be really, really devastating to a family, to an individual. It's hard to deal with that. So, you talked about, John, talking about taking care of the caregiver, making sure that you do take care of yourself, because, if you're not thinking clearly and you're stressed and you're not addressing your own needs, it's going to be very hard for you to be working with your family member to get them to accept help. So having a plan, doing some homework. The fact that people are attending tonight's program, it's great, because you're trying to find information. You're trying to find, that's one of the important steps to take, is get information and educate yourself. Pull together numbers, maybe the medical providers of your loved one, other crisis numbers, the mobile crisis teams in your area, the mental health center number in your area. So doing your homework and keeping yourself a little file of where to go to when you are in crisis and need to reach out. And making sure that you don't try to make decisions about your loved one without their consent or without their involvement. That communication is key. It's really important. If you do something behind their back, it's going to come back to bite you. So it's really important to work with them. And I know it's easier said than done. And you want to do so much to help your loved one, and sometimes you just get these things done behind their back. But really, it's important to be open and to try to communicate what it is that you want to see happen. And communicate that their best interest is what you're looking for. So even sometimes how you present, making sure that your adrenaline is reduced when you try to talk to them, and try to be as direct as possible, saying that, I'm concerned about you and I'd like to help. I'd like to help you find some resources and find some supports. And they might not see, you know, one thing that we see a lot, and family members of Nami will talk about a lot, is how their loved one refuses treatment or denies that they deny that they are in trouble. They deny that they have a problem. And there is a name for that, anosognosia, which is spelled ANOSOGNOSIA. And if you look it up, it's when someone has a condition such as a mental health condition and can't see that they have a problem. So part of the work is working with them and giving them an opportunity and the time to really come to terms with that. So that can be really challenging. And you are not alone. There are a lot of family members who are dealing with this. So setting up expectations and setting up, it's also important too. One of the things we see a lot with family members is, you know, where you have to set limits, clear expectations, set some boundaries of what you will or will not allow, for instance, in your house. But at the same time, continuing to give the message that you want them to get help. So I will show a few slides and to talk about, let me pull this up. Hold on. Can you see my slides? And I can't, oh, there we go. Okay. So some of the things that we offer at Nami, and I think it might be important to just say, you know, you're not alone. There are some supports that you can access at Nami. All of the programs that are listed here are free to anybody in the state. So we have educational programs. Nami Basics is a program especially for family members of children, youth who have mental health conditions. Family to Family is a program, educational program. Both of these, Nami Basics, Family to Family, and Peer to Peer are 8-week programs where you attend a class and learn about the different conditions people may be experiencing. You meet other people in the class who are in the same situation that you're in. So there's a lot of, in addition to learning, you're also connecting with others and realizing you're not alone. So Family to Family is for family members of adults, family, or sometimes it could be a spouse, it could be a best friend, a good friend, a partner. Connect Suicide Prevention is a program that provides suicide prevention education for different groups. Peer to Peer is for individuals who have lived experience with mental illness, it's also an 8-week class where you learn about different aspects of where to get help, different resources, and how to kind of take control of your life. Side by Side is a program. It's a 6 sessions for families of individuals for older adults and their caregivers. And Crisis Intervention Team, which is a CIT program, and that's specifically for first responders. And Nami's been doing it's a 40-hour week training for first responders. So we're working very closely with police, both state police, local police, to educate them about mental health and mental illness and how to approach a situation. So if you are a family member and you need to call police, one thing I would recommend is when you make the call, ask if somebody is trained in CIT on the team. And if you could ask that when they come to the house, to have a trained CIT officer be involved. The advocacy programs that we have at Nami is, and actually when I look at what Judge Broderick is doing, I mean, that's what he's doing. He's advocating. He is advocating for people around mental health concerns. He's giving the message that it's okay to talk about it. It's important to talk about it and to treat it like a medical condition. So the It's Your Move program is an advocacy program where you learn how to work with legislature to increase awareness about mental health needs in our state, and to make sure that the needs, the services and the programs address the needs. In Our Own Voice is a program of individuals who have lived with mental illness and tell their story. And they talk to large groups. It's a wonderful program, and it really changes the way people view mental illness, and I think can reduce some of the stigma. Life Interrupted is people who are family members of individuals with mental illness who tell their story. Survivor Voices are for people who have had lost a loved one to suicide and will tell their story of how they've looked for help and found support. And Nami Walks is an annual program we do to raise awareness. And then we have support groups all around the state. We have currently all of our support groups are being held virtually because of COVID. So you can pretty much access any of these groups from where you're sitting. So we have several family of adults support groups, parents of children support groups, survivors of suicide loss, individuals with mental illness. So these are the connection support groups, connection support groups. And first episode psychosis or early serious mental illness. And these are for family members of loved ones who have very early stages of first episode psychosis or early mental illness. And we also have Facebook-based support groups. So we have virtual support groups where it's live time. So you're meeting like you are right now. But the Facebook support groups, if you want to type in something at 2 o'clock in the morning or at 4 o'clock in the morning or at 12 o'clock midnight on Saturday night, you can do that. So it's 24/7 support groups that it's held on Facebook. And that's for families of adults. We have one for parents or family members of children, first episode psychosis and early serious mental illness, as well as one for military veteran families. And we have individuals who can talk with you and provide consultation on a one-to-one basis as well. We have that for families of individuals for military and veterans, and for parents of children. The parents of children is a very, very extensive program we have around the state, where we have individuals who have their family peer support persons who they've lived what you're living through, and they're able to support you knowing where you're coming from. So it's a family peer support group. And the information and resource line, if anything you can take away today, I mean, that's probably the main number you should keep, because you can call that number anytime and someone will call you back and provide you with any information that we talked about just now, or also just provide you with some support about resources throughout the state, as well as provide you with some guidance of where you could get some help. And this is just another way of showing the resource line. And we have, some services for veterans and service members and military. And I think these slides will be made available to you. If I'm going to ask Angela later about this. We have, this is the website for all the New Hampshire community mental health centers. There are community mental health centers. There's a community mental health center in your region, so just being aware of that, as well as peer support programs. So there are peer support programs throughout the state. So that's another thing that you could, if you have a family member who would like to connect with peers or other people who are experiencing mental health issues, this is also a great support and definitely underutilized. So just making sure that you're aware of this. Making sure too that you're aware of the suicide prevention lifeline. This lifeline, I will say that I have that number listed in my cell phone, and I would highly recommend all of you to do that, because you never know when you're going to run across someone who may need that. They take calls 24/7. There will be a change in the emergency calls for mental health issues starting in January, but they will still be responding to, this line will still be available. And I will say, having that number in my cell phone, I have used it twice when I've been with an individual who seemed to be okay. I didn't feel comfortable leaving them for a whole week without touching base with them, but I gave them that number. And in one case, the person did tell me that they did call that number, and it did, I'm not sure if it could say that it actually saved their life, but they were really very, felt that it was very helpful to talk to someone when they were in the middle of feeling very, very down. There's also the texting number. For people, especially younger people, tend to feel more comfortable with texting. So texting 741-741 is also another way to get some support. And just some general tips for you when you're managing this journey. And I know this time of year is really, really challenging in terms of, we have COVID that doesn't seem to go away, and it's causing extra stress and it's making it more difficult, I think, for family members and for people with mental illness. And actually, Nami, New Hampshire, Nami National has done some statistics, showed some statistics that 64% of people with mental health concerns express that the holidays exacerbates or makes their symptoms worse. So it's a very, very stressful time of year. I know making sure that you as a family member or for all of us to get extra sleep, exercise, get out there, stretch, get some exercise, nutrition, thinking of a healthy diet. You're thinking of hydrating, making sure we drink a lot of water, and manage, especially this time of year, be careful about, alcohol intake, because I think there's a lot of emphasis on alcohol around the holidays. So just being aware of that, making sure that we think about our attitudes, thinking about, what are we grateful for? Sometimes we need to remind ourselves that there are some things to be grateful for. Stay connected with others and check in. And recognize that you're important, that, you are very important for your loved one, that you, as a care partner, as a caregiver, a care partner, or family member, you provide a lot of support. And don't be afraid to ask others for help. Don't be afraid to seek professional guidance. I think this can be very, very challenging. And right now with COVID, there's a definite increase in anxiety and depression throughout the country. You're not alone. And this is very, very real. And recognize that daily routines change can add stress, especially around the holidays. So just being aware of that. And manage your self-care if you're your own caregiver. And wait a minute, you are your own caregivers. So making sure you take responsibility and taking care of yourself. Be realistic about expectations. Sometimes we have to manage our expectations. And that is true when we have these expectations for our family members, for our loved ones. If we have an adult child who isn't quite what we had expected them to be, let's look at that and say, that's okay. It's okay and just being able to manage how we see them and how we expect them to do. Focus on what you can do. So you might have a long list of things to do. Focus on the top, one or two things. Try to do just one thing at a time. Set goals and work toward them. And learn from your emotions. If you're feeling stressed, well, you might have some reason to do that. And what is it that you can do to kind of help manage your own stress or your own anxiety? And don't be afraid to get help when needed. And look at how we communicate. Look at our language. Talking about our loved one or our family member as a person who has anxiety, or a person who has a mental health condition, a person who has a substance use issue rather than saying that they're an addict or they're crazy. Looking at how we talk may be really, really important. And these are just some the website for Nami. A lot of information is available there, and don't be afraid to go into that. So let me stop sharing. And I think we can probably take a look and see if we have any questions or any comments from the audience.
Thank you so much, both of you. We do have some questions that have come in. So John, if you want to just turn your video back on and we can have a little discussion. Bernie, would you like me to share out some of those resource materials that you had?
That would be great.
Sure. Do that. Our first question was, somebody has an adult son that lives an hour away, and they just want to know what the best way would be to support them, being that they're a little bit further from them.
Okay. Well, one of the things I think to keep in mind, so you're living away from your son. One of the things to keep in mind is you can still access services and supports, even though it's remote, especially these days because of the virtual nature. If, depending on how you communicate with your son, like are you checking in with him daily or weekly? Are you checking in by FaceTime maybe? That's a possibility. And sometimes what we hear over the phone may be a little different than actually being able to go visit. So it might be important to connect with them on a face-to-face basis if possible, maybe once a week or once every couple of weeks, so that you can, see how they're doing. Maybe having a communicating with them about what is it that they're willing to accept for help. Do they need help trying to find resources within their region or within their area where they're living? Potentially even getting some help online if are they willing to meet with somebody on, virtually through FaceTime or through, like a Zoom medical telehealth, I guess is the word I'm looking for. So I think it all depends on what it is that you're worried about, and is it something that maybe you need to make sure you connect with them on a face-to-face basis.
Angelica,
Yes.
you can hear me. I can't get back on the video. It says
Let me see what's going on there.
the host says disabled me. I don't blame you for doing that.
Oh, no. You should be able to do that now. You should be able to. There you go.
There we are. Okay. I thought you'd left us.
No, I could never do that. I just want to add one thing. I agree with everything that you've just said, Bernie, but one of the things I think is important, and I didn't follow this rule, obviously, but I didn't know what I was looking at. I'd be smarter now. I think it's really important for someone who's trying to be a caregiver to really learn what the mental illness is that you're dealing with, to really learn about it. And in the world we're living in today, not that everything you read online is accurate, but there's a lot of fingertip information. And so I think it's important, if you're trying to help somebody, to understand what their mental health problems are doing to them and how they may perceive the world around them and you who are trying to be of help. I think it's really smart to become more and more informed. And as Bernie was saying, and as I've learned, persistence and patience are important. And if you can learn about mental illness before it reaches stage 4 and engage the person at a different time, at an earlier time, you may be dealing with it more effectively than if you keep looking the other way until it explodes in front of you. At that point, it's never too late, but it's later than it should be. So I think to be really vigilant about it, to ask questions of medical providers, social workers, therapists, So you really need to be an informed consumer. And that's not always easy, but it's essential.
Absolutely. Education is really, and taking down, having a file, keep a little box or a little file so that you can keep as much information as you can. Definitely, you'll be better prepared and get that homework done. Trying to find more, and the medical providers is a good place to go. Or educate or attending classes. Nami has some programs, but I'm not saying you have to go to Nami. There are other ways of educating yourself and just finding out more. And don't be afraid to get your own therapy as well, to be involved in counseling yourself, because this is tough work. And the healthier you are and the more you're aware of your own needs, the better off you will be to help your loved one, your family member. And also, it's also going to be setting a good example.
I want to share, Bernie, a week or so ago, I was at a forum put on by the YMCA with Charlie Olson. I don't know if you've met Charlie Olson. He's 11 years old. He's one of my heroes. And he's the kid governor of New Hampshire, the fifth grader. He's a cute kid and he's an athlete, and he talks about mental health. And I think Charlie probably has suffered from some mental health challenges himself, although he's such a courageous kid. I just so admire him. And he was at this forum, and one of the adults in the room said to him, Charlie, what do you think adults don't realize that you wish they realized? And, out of the mouths of young people, he said, well, one of the things I realized, he said, when you talk to people, especially mothers, he said, everyone laughed. He said, mothers want to fix everything. That's what they do. They fix, they come in, they're maternal, they want to make sure it's okay. And he said, sometimes you're not asking for that. You want them to hear you. You want people to be attentive to what you're saying, not say, how can I fix your problem? Because then you really stop listening. You're thinking about action steps. And he said, sometimes it's really helpful if someone just sit there and pay close attention and be supportive of you without making you feel like they don't have time because they have to fix you somehow. And I think one of the things that happens, I'm sure I was guilty of it myself, when you really don't know what you're dealing with, and so you think, okay, it must be this or it must be that. And when I found out more, but still not the right answer, I was always intent on fixing it, which was probably not productive, as opposed to assisting someone and helping to guide them and not becoming the resident expert myself. And there's a tendency, especially with people you love, to say, I can solve this problem. And most often you can't solve it, but you can assist them in solving it. I think it's important to know that. No one's expecting you to fix it, but they are expecting you to be attentive and to listen and to know when things are being elevated and what to do then. Bernie's point about making a plan, know where the resources are. I will say this, I've had calls over the last 5 years from parents who have children, it's usually a son, who has acted out in their house. And he's living with them, and they get frightened from time to time. And they don't know what to do. And I said to them, what I would do if I were you, not to get them in trouble, but you don't know where that's going to go. And it could just suddenly go quickly. I would go down to my local police department. I meet with the chief or somebody and say, look, I'm not here to get my son or daughter in trouble. That's not why I'm here. I hope you never come to my house. I love my son and my daughter. They're great people, but they have some mental health issues now and they're getting help or working on it. But if I ever call the station, not that I hope I ever have to do that, and let you know that there's a problem in my house, when you arrive, I want you to know the person in there's not evil. The person has a mental health problem, because the police, as you point out, Bernie, are getting much greater training now in dealing with mental illness. And it's a lot easier for them to know that in a quiet office visit than on the front steps of your house. So I encourage people who are concerned that that could happen, and hopefully that would never happen, but that you don't start talking about it in a nervous voice on the phone, that you're able to call and say, it's my son, I told you so. When you come here, please remember what I told you. I think that's good to do.
That is really important. That's a very important tip. And I have a friend and colleague who often says that, and she's had an experience of having a family member who has a mental health issue, and sometimes they've had to call the police. And she has this arrangement with her husband that, one of them goes out and meets the police outside and talks to them, and the other one stays in the house with their son, so that they're able to tag team and be able to intervene and inform whoever the police officers are of what's happening, and tell, kind of giving them message that it's not a bad person in there, it's not a criminal, it's someone with a mental health issue, and he's really struggling right now. So that's a very important tip to provide.
But
And again,
if we live in a world, Bernie, where people are ashamed, that needs to happen.
Yeah. And it's unfortunate that that's how we view it. And I think we need to all work together to change that. Absolutely. And, being able to, it's educating yourself. It's also finding support, and whether the support is in a one-to-one office with a counselor, or a Zoom call with a counselor on a regular basis, or in a support group of some kind, finding someplace where you don't have to feel alone. And while you're in support groups, for example, and I know support groups are not for everybody, but what seems to happen in support groups is you learn from others who've been there, done that, and what did they do that helped them. Who are the good therapists? Who are the, where do you go for some help? And there's a lot of that stuff that happens in the support groups as well.
Well, I think also, Brian, sometimes, even though parents love the person, if it is a child, it's not always a child, but it doesn't matter who it is, but sometimes you're not the right person to have the conversation. You might love them than anybody else. That doesn't mean you're the right person. And sometimes it's important for you to know who your son or daughter may be close to, because maybe it's that person that should have the second conversation, and they may hear it differently. But the one thing that I know, and I've learned it from my son too, is when people think you are judging them in their mental illness, that's not a good place for them to be or to feel like that. And they're perceptive. Most times they're extraordinarily perceptive. They want to be treated with respect, as all of us do. And it goes back to my point. You can't say, don't worry about it, I'm going to take all the burden off your back, because then you're making them a potted plant. They've got to play too. They've got to be involved in it. And you've got to be a constant assistant and coach and encourager. But sometimes it may not be you that could do the job. It may be a friend or a relative in the family that has a better relationship at some level. So I just encourage people to realize the whole team may not include them in a very direct way, but just to give it some thought. There may be people better positioned. It might be your brother or sister better to talk to the person than the mother.
Yeah.
Right.
Really good. Really good thoughts. And I'm sure we've answered quite a few questions, I hope, but we're going to get into a couple more. We have someone who, we've talked a lot about talking to our loved ones about their mental health issues, their mental illness, and really having a conversation and talking. But someone's concerned because in their experience, that's never solved the problem. It never feels like it improves it. It usually feels like it makes it worse. So they really don't have a lot of confidence in the ability about talking to improve anything. So where do they begin in having that conversation? How do they start when in their experience it's only been a negative?
And I don't know if did you want to take this, John, or did?
No, all I was going to say, Bernie, is everybody with a mental health problem is in a different place. It could be the same mental health problem. Everyone is different. But I think what nobody wants, whatever place they're in, they don't want to be lectured to. They don't want to be told that I know what your problems are. You may know, but that's not a conducive way to start because it neutralizes them. I think, kind of open-ended questions, non-judgmental questions. How are you feeling? How can we help? What do you think would be helpful? At least they're not feeling at risk. But sometimes they feel like, wait a minute, what are you doing here? What are you telling me? They're not in a place to understand your good intentions. So your language matters, how you approach it. And, my experience has been that oftentimes the first try doesn't succeed, right? I mean, it's a process oftentimes, but ultimately it comes down to trust. So if the person who's suffering trusts you, which even though they may love you, they may not trust you. It's important you earn that trust. So they know that what you're doing is really in their best interest, not your best interest. That's a fine line. So being too assertive, too aggressive, too matter of fact, got to be patient.
Yeah. And also recognizing, in addition to that, recognizing where they may be at in their, when we look at how people change and how they, like even making a decision of, for instance, of going on a diet or losing weight, at what, there are different stages of someone being able to make some changes. And as a family member, you might have done all your homework and you might say, oh, geez, I know all about this. But they might not be at that stage. So trying to meet them, I know this is easier said than done. I realize that. But trying to meet them where they're at, asking them, listening, taking time to sit back and asking them what they want. It might not be where you think they should be. It might not be exactly what you want to hear, but starting with that and recognizing we can't make everybody change, but we certainly can listen, and listening will often may open a door. And I know that's easier said than done. I'm saying we're talking here, recognizing that there's some very, very challenging situations out there, and especially when someone isn't, doesn't realize that they have some symptoms or they have a problem.
I think it's important, obviously, if it's at a crisis stage, the options may be very different. But I think, most people are getting more perceptive about mental health problems. And sometimes it's worthwhile. There's no crisis, there's no emergency. Just have a conversation, say, how are you feeling? How are things going? You're looking better, you seem better. Just to have a thoughtful discussion with no end game other than just engagement. I think oftentimes people with mental health problems, when people engage them, it's because something's about to happen. And oftentimes they don't want that to happen. So most of us have casual conversations, and those who are mentally ill, I think sometimes we think, well, we'll talk to them when there's a problem. No, we should talk to them when there's no problem. And it doesn't always have to be at how they're feeling. You don't ask that of everyone you meet. I think they want to feel mainstreamed and included. I agree with what Bernie said about having expectations, because if you don't have any expectations, that's almost dishonoring them in a way. It's like saying you can't do anything, so I have no expectation. You got to have them within parameters that make sense. But I think it's important that you do. But my goal is find out what you can as early as you can and start to deal with it when it's not a crisis level. I had the director of Mental Health America, who's from Connecticut. I was talking to him maybe a year ago. And he said, John, mental illness is the only illness I know of where we don't start treating it until stage 4. And he laughed. And I said, a lot of truth to that. We don't wait for the tooth to be pulled. When it starts hurting, we do something. And so we need to treat mental illness more thoughtfully sooner. And we need to learn about it sooner. And we need to be patient with those who are suffering.
Great points. We have another question, and this we've talked about it a little bit, but addressing burnout. You know, there's someone here who has been supporting their loved one for decades and has been on a roller coaster of constant crisis, and just trying to figure out the best way to support them, even though they might be kind of burned out.
Yeah, and you know what we're going to say about that, right? We're going to say we need to take care of your burnout, of the depression or the stress. That it's really important to pay attention and to take care of that. This has been going on for years. It's probably not going to go away tomorrow. The person will probably survive without if you take a little break and take care of yourself. That it's really, really important for people to practice what you preach. You know, you need to address that stress, and burnout is there because you keep doing the same thing over and over again, and it's not making a difference or not making a change. Somehow we need to also take some time to recharge your battery and pay attention to your needs. And I know that sounds maybe cruel, but it's really, really important. And I think, what I have seen with families members who, really worked hard at taking care of themselves is they feel stronger, they feel more capable of providing support. That compassion fatigue can really get the best out of you and is not helpful in your relationship. And I don't know if you want to add anything, John.
All I would say is this, and I think on one of your slides that I saw either tonight or not long ago, the example you used, which is a very good one, it's the airline example. So if you're on a plane and they tell you if the oxygen mask drops down, which is a thought I don't really like to hear the pilot say to me on the plane, but I listen. And what they say is put the mask on yourself before you try to help the person next to you. And that's true in this context. So the caregiver has to take care of themselves, or you're no good to the person you're trying to help. I think the other thing that's important to keep in mind, it's kind of what Charlie Olson said, which is don't assume your job is to fix this person. Because if you could do that, you'd have a different job title, okay? You're not a clinician, you're not a medical person, you're someone that loves them. And really, I would think of myself as being the guardrails so that you know when things are getting bad and you're managing their care as best you can. Others, treatment works, by the way, I know that too. And so others are the pros. That's why we're not doing what Bernie does or what doctors do or psychiatrists, but we need to be informed, but don't put the pressure on yourself that somehow between Monday and Friday, you're going to make this person go from A to B to C, because you're not. You're not. You can provide support and you can be the guardrail, as I said, to make sure the car doesn't leave the road. But don't add that stress to yourself that I need to fix this, because you alone can't. You're important, but you're not the fixer ultimately.
And what can happen over time is, someone can get you can, as a caregiver or as a family member or a loved one, you can start resenting them and be aware of that, because if that starts happening, you need to fix that. You need to continue being their family member, and let that work of fixing it be with the professionals as well, and other people.
Absolutely.
Yeah.
That's great. So we have someone who's frustrated trying to help their daughter, but their daughter won't sign releases for them to speak with the doctors, and they feel that they can't talk to the doctors without her consent. And HIPAA just feels like a huge obstacle for parents, friends, and others to help. So is there a way, what is the best way to tackle that obstacle of not having a direct line to a loved one's medical professional.
Keeping in mind that with HIPAA, or, you know, as a family member, you have the right to talk to the providers. They don't have the legal right to talk to you unless they have permission. But you do have the legal right. If there are some things that are happening that you're very concerned about, that may be posing, you know, it may show that the individual you're concerned about may be at high risk for hurting themselves or hurting somebody else. It's really important for you to be sharing that information. And recognizing that they can't even acknowledge that they're helping the individual. But also the other thing that I have found is making sure that you're honest about not doing something behind someone's back, because that comes back to bite. Especially if someone is experiencing, you know, some paranoid type symptoms. It'll make it even worse. So, you know, being pretty honest. If somebody, for instance, is experiencing symptoms like hallucinations or delusions, you know, don't spend a lot of time arguing with them and trying to tell them that that's not real. Unless they ask you, you know, do you, like if they're hallucinating and they're seeing something that's not there, and they ask you if you're seeing that whatever it is, you can say, no, I'm not seeing it, but I understand that you are. So acknowledging that is what they're experiencing, and focusing on their emotions or what they're feeling like, rather than whether or not what they think or what they see is real. So trying to focus on that, you know, and supporting them where they are with their feelings, and asking them how they are. And it can be very frustrating, especially when, you know, you realize when I've experienced that when my son's going to college, and all of a sudden you can't even talk to the medical provider at the college unless they sign this paper, and they forget to sign the paper. I mean, I think that's a really minor example of what you're talking about. You're talking about somebody who's experiencing and is under care. So having that conversation with your family member and trying to open that communication is really important, and so that they will then allow you to talk, you know, potentially open a door to allowing you to talk to their provider.
I agree, Broderick, with everything you just said. And I think part of the problem is a lot of folks sometimes who have mental health problems, they are usually the last ones to know what those are. And they often see people, parents sometimes, as intruders. Like, you're not going in there to help me. You're going in there to run me down, or you're going in there to tell them something. And so that may not be true at all, but they don't see it that way. And I agree with what Bernie said too about reaching out. You can do that. And usually the doctor or counselor will listen. They won't say anything. But I would caution you, I wouldn't do that just casually. It would have to be pretty consequential. If it's, well, I'm not sure he or she's telling you this, or last weekend when we went out, that's minor stuff. If it's consequential, then you say, okay, I'll balance that. It's worth it, because I agree with Bernie. People will, if they find out about it, and somehow they always find out about it, they will think you're trying to undercut them, and they will never trust you. So it's a very fine line, and it's difficult. In some cases, you could try to go to court and be appointed guardian of that person, but that is not easy to do. And if that doesn't work, you never build that trust again. And even if it does work, it's not perfect. It may not be worth it at all. But it's just difficult. It's challenging.
Yeah. And sometimes even having that conversation with your family member there is, if possible, that is probably the best scenario, because it's talking openly. There's no secrets, talking openly and allowing your family member to be in control. You know, they're the central person here that we're concerned about. So giving them some control that way And I know sometimes, you know, they present with symptoms or with plans that can be very, very concerning. And there is a line to cross where if you're really concerned about their safety or other people's safety, you really do need to kick in and you know, and speak up.
Yeah, great points. Could you talk a little bit about how to de-escalate situations? Like, what's the best way to go about de-escalating a situation? Maybe something happens over the holidays, and how do we go about smoothing that over?
Mm-hmm. You know, one of the things that can be really helpful, if possible, is to try to control the environment. So if there were a lot of people around, you know, trying to get people to stand away, to reduce the energy in the room, in a sense, you know, trying to keep calm things down, the environment as much as possible, giving that person space. The best time is probably one of the best things to do when things are escalated. So if you are able to give that person some space and time to de-escalate, step aside. Of course, if there's, you know, there's something, if somebody's in danger, that's a different story where you do need to kick in. But don't try to solve the situation right away, giving them time and space to calm down. That probably is the most important helpful thing that can help to reduce somebody, help to de-escalate a situation. Standing away from someone, you know, sometimes even changing the atmosphere, like maybe going outside where it's a little cooler to kind of change the environment a little bit. And being aware of how you come across. I know it's easier said than done, but you know, if you go in with a lot of anxiety and a lot of adrenaline going, you know, that's what they're going to react to. They're not going to react to your words. They're going to react to how you're saying them. So being aware of that. I don't know if you wanted to add anything, John.
Well, I think that's very good advice. I would say that depending on the circumstance, if someone's really getting irritable or upset, maybe just validating that you know how they feel. I understand how you feel. And you may not feel that way, but you understand how they are reacting. So you do understand how they feel. And say to them, but you know, we'll have a chance to talk about it, but probably not right now. I understand why you're upset. And I want to hear more about that. I want to talk about it, but maybe not right now. If they don't feel threatened by it, that someone's saying, hey, I understand you're upset. It's okay, but maybe we ought to deal with it a little bit later or in a different way. As opposed to saying, why are you upset? You have no right to be upset. That's just going to agitate them. Mm-hmm. So just acknowledging, you know, why they're upset, and we'll deal with it.
Yeah.
But it doesn't have to be second.
Yeah. Yeah. Telling somebody they don't have the right to be upset or that they shouldn't be upset, not a good thing to do. You know, because they feel the way they feel. So acknowledging that's how you feel. I know I see that you're upset right now. I think you're upset, right?
Yes.
Rather than you shouldn't be upset.
Yeah, you're just to add fuel to the fire. That's not good.
Yeah.
Yeah.
Not good.
Yeah, and the holidays can, you know, be a time too where there's a lot, you know, alcohol flowing, which sometimes is not very helpful, and can add to the escalation of an issue. So being aware of that, yeah.
We have some great questions coming in. This one actually kind of goes to the state of mental health care in New Hampshire. You know, if somebody does end up calling for help, and because somebody is a danger to themselves or others, and it lands them in an emergency room, you know, how is that helping? And is there a better way? What do we do?
I think I agree that the system right now is not ideal. One of the things that will be happening come January is that each of the regions in New Hampshire will have a mobile crisis team available. So instead of waiting for things to get to the point where you really need to get into the emergency room, and some of these mobile crisis teams are available in some parts of the state already, where you make a call and the team comes to you or comes to your loved one. And I know there's some changes that are coming around the corner. I hope they are positive changes. I have a lot of hope that things will be better. And I think that there might be some challenges at first because it's going to be a new system, right? But I'm hoping that, at least it's going in the right direction in terms of trying to prevent. It's like being able to go to an urgent care place rather than waiting for a situation to just get to the point where you have to go to an emergency room, or going to the doctor's office before you have to go to the emergency room. So not having to wait till a situation is that extreme that you have to go to the emergency room. Now, there will be some times where people will have mental health emergencies where they will still have to go to the emergency room, but hopefully these mobile crisis teams will be able to catch things a little bit higher upstream before it gets to that point. There will be a lot of information available, I think, come January of what numbers to call. Come July of 2022, the number will be 988. But there will be a period of time where there's going to be a special number to call in New Hampshire. And I recognize that it's not an ideal situation right now, but we need to keep working on improving our system of care.
Right, I just want to jump in briefly because that question is so cogent, which is what you do. I mean, on Valentine's Day this year, we had 51 kids and adolescents in community hospital emergency rooms. Community hospitals are great, by the way. They're the backbone of the system, but they're not prepared to deal with acute mental illness. And some of those kids were there for hours until they found an appropriate bed somewhere else. Or some were there for days, a few were there for weeks.
Mm-hmm.
It's really not right at so many different levels. And so you really need systemic reform. We don't have enough psychiatrists. It's not just in Hampshire, by the way, it's nationwide. We don't have enough psychiatrists. We don't have enough psychiatric nurse practitioners. We don't have enough people like Bernie, trained social workers. We don't have enough mental health counselors. We don't pay the people who do that work what they deserve to be paid. We don't reimburse them in the insurance market the way we reimburse people who provide procedural medicine, orthopedics, and neurology, obstetrics and gynecology. We don't. And unless and until we start doing that, and some of the things Bernie's talking about, which is mobile crisis units, they should be on the ground now. We need them now. And we need more transitional housing. So when people are at the state mental hospital, but they really are not ready to kind of be released, but they could go to step down housing. We'd have that available so we could free up their beds. And there may also be respite housing for people who don't really need to go to the state hospital, but shouldn't be staying where they're staying. And they could be getting treatment there too. There are so many things we need to do because there are so many people and families who are dealing with it. And as I said in my remarks at the beginning, if you look at the way we treat cancer of all kinds, HIV/AIDS, dementia, diabetes, there's a protocol, a place, an entrance, and it's usually covered by insurance. People who deal with mental health problems, it's kind of a morass. I mean, my heart goes out to people. I've talked to so many family members who don't know what to do, who don't know where to go, don't know how long they can afford it. So my value, my thought is the value is we need to talk about it more, be honest about the need, and we need 100 more Bernie Seiferts. We do. We need more people like you. We need more people in community health centers around the state. And they're the backbone of mental health in New Hampshire. Community mental health centers are great, but they don't have the staff or the budget or the resources they need. So everybody on this call could help on that front. And it's not just New Hampshire. I'm not picking on New Hampshire. It's like that everywhere. It doesn't need to be. But until we deal with it, we'll always be that way. It's been that way for generations.
Thank you. That's great thoughts. So we have someone who would like to know, how do they feel like they're trying to support their loved one in their struggles, but it also feels like they're enabling them. So how do we reconcile supporting our loved ones while also being honest about how mental health impacts our life and our own mental health?
And I know it's difficult to do this, but to be really totally honest, excuse me, is, I don't think we should hide how it is impacting our lives, but it also, to give the message that, that you care and you love them. And the reason why you're so involved is you want to be helpful. But if it's impacting your life, you need to also put that up on the table and work on trying to get some help for yourself as well. Again, I can't say that enough, that we all need to be mindful of our own mental health needs. And it's not just taking care of someone, being a caregiver and being a loved one of a family member who, that can be very stressful, and we need to take care of ourselves. That compassion fatigue can really have an impact. And if we don't pay attention to it, what happens is we become resentful, we become angry, it becomes more difficult for us to be supportive. So, if trying to have an open discussion about how it is impacting you, but that in saying also, but I have to do something about it. I'm going to do something about it. I'm going to get help. Support groups can be helpful. Counseling can be helpful. Educating yourself. And sometimes some people find a lot of they feel that being an advocate is a great thing to do, and it makes you feel better. I know, at least going out there, and one thing that we see a lot of people on the sidewalk with signs about other causes, and I think we need to do more of that for mental health and for mental illness.
We sure do. Right. One thing I would say on the enabling point, which is, everyone's guilty of that. If you love somebody and you don't really understand what the suffering means in day-to-day terms. So if you have no expectations for the person who you're caring for, you are by definition enabling them not to take any responsibility. So supporting someone is different than doing everything for them. And so I think there's a fine line. So assume that, now there are exceptions, but most people who are suffering a mental health problem are not helpless. It's not like they can't do anything. It's not like they can't execute things. They can. It may be difficult for some of them, or it may not be as difficult as you think, but you need to have some expectation. So the difference between supporting someone and enabling someone, if you're supporting someone, you're working hard, but you have expectations that they're going to do something. When you're enabling them, you're basically doing everything. And that's not fair to them either. And that's not a solution. That is not a solution. That's just increasing the burden on you. So decide where that line is, and in a nice way, insist on it. That's not being mean. That's maybe being helpful, actually.
Right. You're doing them a favor.
Yes, absolutely.
By giving them the power to,
And I'm going to turn my video back on. We are at about 7:27. This has really been great, a great discussion. And I just wanted to give you both the opportunity to take a minute or two to talk about closing thought, like your closing thoughts, And I also just wanted to let everyone know that the slides are in the chat and there's some resources in the chat. If you'd like to download those, feel free. Again, everything will be available on our webpage, which is go.d-h.org/HLS. And if you want any of the resources, this video will be there, and those slides and resources will also be there. So I'm just going to give you guys a couple minutes to wrap it up with your closing thoughts, and then we'll let everyone go. Thank you.
Well, I will say that one thing that I am so impressed with you, John, and I think that this is an important point, is, you know, your vulnerability that you've put forth in the last 5 years of the work that you've done. It's very different than the work you've done for years before that. Both of them were very, very important. But being able to, I mean, you've said, you know, that we need more social workers. I think we need more people with this experience. We need to listen to people with that lived experience. Peer support is something that we have not used enough in this state. And you know, I'm not the expert here. We need to take people's experience and learn from that and work together. You know, and I would encourage people to take a look at advocacy, becoming advocates, and becoming, you know, working towards changing the way we do things in the same way that what you've been doing for the past 5 years, making a big impact. We'll still have a long way to go, but we need to improve our system of care.
And we really do, Bernie. I tell you, and I mean this sincerely, I'm sorry to see Ken Norton step down. I realize the man's entitled to a life. I love Ken Norton. Nami has been such a huge part of, and it remains such an important part of what we're doing. God love them. If we didn't have Nami, we'd all be in real trouble in this state. What I really want people to know is, as I said at the beginning, you're not alone. That doesn't mean you're going to have help with a snap of your fingers, but there are a lot of people out there who can help you. And sometimes that's not a physician. I think we also need to start to learn about mental health, what it is and what it isn't, and to understand that treatment is very helpful. And so we need to find it sooner. We need to deal with it more efficiently, and we need to deal with it with no shame. I tell that to kids in every gym and auditorium I go to. And you would be amazed when you make yourself vulnerable, which obviously I do, people will open to you. It's not a mystery. It's not me. It's vulnerability creates vulnerability, and people will share. We need to be able to do that. So if you have a loved one who's suffering, don't be ashamed to say, you know, he or she's got some mental health issues and we're working through them. And I appreciate your asking, and I maybe ask you for some help at some point. There's no shame in that. There's no shame in that. And I think that's what we've got to get rid of. It's that mystique of mental illness. The people who are mentally ill are your brother, your father, your cousin, yourself. I mean, that's how it works. It's not somebody across town with a shutter that's broken on the front of their house. It could be the CEO. So I think when we realize it's an equal opportunity health issue, that the treatment works, and that we need to talk about it, change will come. You're welcome.
I agree.
Anyway, thanks everyone on this video.
Thank you so much. Thank you both for being here. We appreciate your time and your knowledge. Thanks so much, Bernie and John. And everyone, please be well, especially this holiday season. Stay well. Shout out to all our healthcare workers who are really struggling right now. And thank you so much for being here. Have a great night.
Thank you.
Thanks. Bye-bye.